I do want women to know that there is an alternative to suppressing their bodies with hormones, that they can see their body as a good and they can live in that body holistically.
Totally. Oh my gosh. It's amazing.
Join co-hosts Jamie Rocci and Teresa Kenny as they educate women about the beauty of the feminine design and empower women to take charge of their health.
They're going to be so amazing. You're going to be so empowered by understanding your feminine genius and your hormone genius. I don't think I could live my whole life knowing this and not sharing it with anyone.
Hello and welcome to the Hormone Genius Podcast. Today we're going to be continuing a conversation I feel like we've started in a few episodes about pelvic floor health. But in this episode, I'm very happy to say that we're actually going to bring men into this conversation too. So I know we have mostly women listeners, but we also know that women a lot of times are encouraging their husbands to take charge of their own health as well. We have a great interviewee today, Dr. Liz Jones, a pelvic floor physical therapist from Bismarck, North Dakota, who has years of experience. She's been working since 2007, treating complex men's and women's pelvic health cases. So today, Liz, I want to start with why do you feel so passionate about pelvic floor health, particularly for men? And let's just start there with men, because I think women are going to be like, what are they going to talk about here? I don't think we've thought about pelvic floor therapy for men, but why is it that you started, I know you've worked with women too, but started to move into this realm of why it's so important for men to consider pelvic health therapy as well?
Hi. Yes. Oh, thank you for having me. So excited to be here. For the men, honestly, I guess as a physical therapist, I always love the intricacies of the body and how it all goes together and the puzzle pieces and the fulcrums and the levers. I'm very much anatomy geek in that way and a physics geek, I guess. And my initial training, I started doing a lot in women's pelvic health. And then logically, I thought, well, men have these muscles too. It's not just a vagina and the things we see on the outside, right? It's the deeper pelvic floor. It's the structure of our stability. And men have the same muscles. There's a few obviously differences from the muscle structure and obviously the genitalia. But the more I worked with men, realizing how much they are not being tended to in this area. It's a vulnerable space. It's a space not many men want to talk about. It's a space of intense insecurity and fear. Oh my gosh, my testicles hurt. What's going to happen? And then all of a sudden there are implications with intimacy, and they don't have an OBGYN to go talk to. I feel like women kind of have a roadmap if there's any concerns in the pelvic region. Men don't. And if their primary care physician isn't very comfortable talking about this, they may bring it up lightly and then it's never talked about again. And there's a great study that one of the main reasons men quit seeking care for pelvic pain is because they feel that the medical provider doesn't understand.
Man, I am so glad that we're talking about this, because I can imagine, Dr. Jones, that there are women listening right now and they're like, oh my gosh, my husband struggles and we struggle. And when one of us struggles in intimacy, we both struggle, right? And so this is such an important topic. So Dr. Jones, when we're thinking about men's pelvic floor health, what are some of the common and maybe not so common issues you see come up? Let's start there, and then we can kind of dig into even why and what are the causes of some of these issues that maybe seem so vulnerable to talk about, which is why, of course, we never really hear about it. So let's start with some common and then uncommon things that men struggle with, and then work through like why some men are struggling health-wise, and then even some of that emotional stuff too.
That is a very good question, because not many men come into my office with the writing on their intake saying fear of intimacy. Hardly anybody ever writes that. So I've been treating complex pelvic cases for 20 years now, and I treat internal hemorrhoids, which is very different for a physical therapist. So I actually see many men for that. And as they are in for that, then I will bring up the questions of, okay, you've got pain here, you've got irritation. Do you realize that can cause some pelvic tension? And I show them what the pelvic muscles are. And I do just kind of go through a blanket statement for men and women. When there's tension in these muscles, it can also affect a lot of other aspects of your life you may not think about. It may, for men, I'll say it may give you some testicular pain, pain with urinating, pain with bowel movements, pain with ejaculation, fear of ejaculation, or noticing changes in your ability to be intimate, digestive issues, constipation. I'll kind of rattle off this laundry list. And it is interesting because some men right away go, oh, I have all of that. Or they may not say anything. And it might be the second or third visit. They come back and say, you mentioned something once about having pain with an erection. Yeah. And then I just go right into the very basic physiology of, are you noticing it with spontaneous erections? And again, men, they're trying to be so respectful, and they don't know the word spontaneous erection even. So they're like, sometimes in the morning, like you'll notice there's sometimes I will just jokingly say morning wood. Yeah. Yep. Okay. But I will say that's called a spontaneous erection. And so we talk about, do you have pain with that? Or is it more just when you're trying to be intimate with your wife? And so I'd say that, go back to answering your question, the thing that most people come into me for are going to be pelvic pain, tailbone pain, hemorrhoids, low back pain, SI stuff, because we've been around for a while, and so many pelvic conditions can present with a lot of bizarre, complex other conditions, as we see with endometriosis and things like that. We often get patients that have tried multiple other things and haven't gotten better. So it's still presenting, they aren't progressing like they should with normal therapy. So then they end up in our clinic, I guess. So we learn to look at all of the intricacies. So yeah, and a lot of men, I do have men with testicular pain that come in, hernias, concern of hernia, but all imaging has ruled it out. So what else is going on? I do see a lot of men at post vasectomy. I was told this was an easy procedure, and I'm miserable. And again, it might be an easy procedure surgically. However, men aren't used to having that area worked on. So they're usually awake. They hear things. They smell tissue burning sometimes. It's very traumatic, and no one warns them. It's go home and put a bag of frozen peas on it and you're fine. And then they don't talk to each other about how bad it was. I had a gentleman that all of his friends said it was no big deal. He had this horrible pain. I talked him through it. And he comes the next visit. He goes, I'm telling all my friends how bad it was. They're like, yeah, mine was terrible too. He's like, why didn't you tell me? You all said it was fine. So again, there's this, we got to be tough. We got to provide. There's not a lot of space for men to really be vulnerable and say, hey, I'm really concerned about this. And a lot of times it's like, hey, nothing to worry about. It's a muscle. And other times it's like, hey, yeah, let's get some imaging. Let's get you to a urologist and look at this.
That is so true that we don't oftentimes give men a space to talk about these things. I mean, it's come a long ways, like for both men and women. I mean, women finally, I feel like, are having a voice in a lot of ways. And we're finally talking about pelvic floor therapy. For women, I think a lot more, but I mean, like everything, it just takes time for the whole thing to come full circle. But you're so right. Like I often hear women in my office talk about vasectomies, and I don't know, there's this little tongue in cheek, like, well, it's time for him almost to suffer. I've suffered, through all of these years of taking birth control and IUDs. It's like, I don't know. I get this sense that it's like, finally, like he's going to have to deal with it. And I don't know, that's not necessarily like a great attitude. Number one, it's not great that women are put in a position where they suffered. This just shouldn't be the way it is, but it also shouldn't be like we have to equalize the suffering between the two, and this is something I think we have to communicate about, because it is so like sacred and intimate, like these parts of our bodies. And sometimes there is a lot of fear and shame and things going on there. It's totally whole body, mind, and soul in this area. Right. And so you're working to connect those pieces all of the time. And that is going into places that are, again, sensitive. What are like, I don't know, like, especially when we think of men and their kind of like their desire to be fully men. And I think this goes into sexual intimacy and erectile dysfunction too, and their ability to feel like they are a man who is, healthy and well in that area. But in that area, where do you see like you can really help men diagnose some of those things? I think ED is a big concern for men, and probably one of the biggest ones. And how can we help them kind of get to the bottom of that?
That's such a big door to open. And there's so many. Again, I love, like I said, the anatomy, physiology, right? And a comment I make a lot is strip it down to the simple truths. When our bodies are so intelligently and intricately made, when things are ordered, when things are healthy, I mean, pretty much every podcast you guys have talks about the natural order of the body and the physiology and if it can be healthy. That is the same thing with intimacy. And I do want to put a disclaimer out there that when I start talking more about the intimacy, I am talking about in a very healthy, loving, respectful relationship, right? Because there are definitely relationships where it is not healthy, where husband or wife is not feeling safe or in a healthy place, right? And that doesn't have to be some severe traumatic abuse going on. It can be very subtle, right? So I do want to put that disclaimer out there that when I say these things, if you are not in a healthy place, this doesn't mean, oh, I just need to be ordered and it'll be better, right? But for men, it is so interesting to me that, and I even had a urologist say this to me, is there a certain personality of man that has pelvic pain? And I just laughed because I said, yeah, I would say so. I have never had a man who's an absolute a-hole jerk in my office with pelvic pain ever. I'm like, maybe they wouldn't go to a female for this. Maybe that's the case. But when men are in my office and they have this deep chronic pelvic pain, I usually look right at them and say, you know what? When you are the true, honest, authentic masculine protector, this is a lot of times where you hold a lot more. This is where you process more. And I had one gentleman, he was so funny. He goes, you know what? You are so right. All my brothers are kind of jerks and none of them have these issues. I'm like, well, I mean, not that that's the tell if you're going to have pelvic pain or not, but there is. I think men, right? They're naturally ordered to hunt, kill, protect, provide. Now, even if your husband's at an office job, does not mean he is not hunt, kill, protect, providing for you and your family. And men feel an intense pressure to make sure their family's safe, to make sure their wife is okay, to make sure their children are provided for, to make sure financially they're okay, right? And so I think that brings a lot of pressure on men, again, that we don't always think about. And then they get a really bad rap for, oh, all they think about is sex, this and that. You know what? That's the natural order. Men are fertile every day of their lives. Women, we're fertile for that little window, which you guys talk about a lot. And so again, in a healthy relationship, I tell women, you know what? I get that can feel frustrating at times. It can feel at times like a burden or a job because you're tired, you're spread thin, and your husband wants to be intimate. But can you, for a minute, look at his viewpoint and realize he's trying to connect to you. He misses you. He wants to be with you. And yes, there's a sexual drive for that. But so many men, I love the superpower, the hormone superpower episode you guys talked about, because if you look at that from the man's lens, one day I come home and I do a few things around the house. And my wife's like, oh yeah, okay. You're really attractive right now. And literally the day after ovulation, she is like, pick up your towels and why is the house out of order? And just touch me with an affirming touch. Why do you always want sex? Right? So many women don't understand their own cycle in that regard. So think about these poor men who are coming home and they don't know what version of you they're going to get. And with intimacy, it is one of the most vulnerable places you will ever be with another human being, literally stripped down, naked, raw. It is really hard to talk about that, let alone talk about your insecurities around it, let alone for men. I have so many men who say, they're concerned about their wife with intimacy. She has pain. Sometimes she's not comfortable. And then I feel like a jerk because I want to be with her, but she's hurting. And sometimes I know she's just getting through it, which makes me feel like a terrible husband. Right. And we sometimes as women, we put this badge of honor, like, well, yep, I'm making sure we have intercourse. What does that do to him in that natural order? Right.
Yeah.
And yeah.
What kind of advice then do you give if the husband is like, oh man, I just miss my wife. I want to be close to my wife, and my wife is just so not interested, or I sense that she's doing this out of a sense of duty. or whatever, but that doesn't make him feel well. What kind of advice would you give to this man and woman in this case?
I pull out my Creighton manual, but talking about intellectual intimacy, emotional intimacy, physical intimacy, right? Showing them that, hey, I don't know where your guys' relationship is. I don't know, because I don't know their wife usually. How are you guys doing on these other realms? For women, it is very emotional. I had a very wise woman say to me once, she goes, I told my husband, I realized after working with you, Liz, that after we have intercourse, that's when I start to really need him, from a like snuggling standpoint. She's like, he's kind of like, oh, that was great. And she's like, that's when I really want to be held. So Mike, as hard as it is, it's easy to say, hard to do, is I will really encourage them communicate. And I try to help them understand their own insecurities, their own areas. For men, there's physical issues, there's psychological, social, cultural, interpersonal. So for them to first know their body, I have we call it a pleasure map that I will hand men. And I'll say, I want you to go and circle the areas on here that you feel safe and comfortable and like to be touched. And I want you to put X's on the places that you might not. It's not that you don't feel safe, but maybe it's like, ugh, I don't like that, right?
Mm-hmm.
Like, some people are like, yeah, I have digestive stuff. I don't like when she rubs my stomach. Or maybe, maybe his mom used to rub the back of his neck. So when she does, he's like, thinking about my mom right now, right? She doesn't know that. So that communication, because when we talk about intimacy, and it's such a sympathetic response of fight or flight, if our body, male or female, is going into that, it's going to shut everything down from an arousal standpoint. So to have those open conversations, what do you like? What do I do that makes you feel safe and provided for at home, in the bedroom? I think those are important conversations.
Yeah, that's a great tool also to just sit down, schedule some time, have a little date night for each other and just say, this is the pleasure map for me, this is the pleasure map for you. And I can imagine for women, and I can imagine for myself, that's going to shift based on where I'm at in my cycle, by, what I want and wherever. But I wanted to say too, something that I've been thinking about a lot, and this probably comes up more, I can imagine, and I'm only just imagining. But my husband and I have been married for 15 years. And it was at the 10-year mark where I'm like thinking more about, man, how can we amplify our intimacy? It's just, I feel like women through a number of years, we just kind of settle in and we focus more on the husband and kind of that dutiful wife sort of thing. But I just started picking up more, and this has probably been something I've heard a lot and it just didn't pick up on it. But lately I've been thinking about oxytocin, and how, when you're being looked at for, I think there's all these studies. I'm just going to recall what I can, but 6 seconds, straight 6 seconds in the eye, it just, that person's actually looking at you. There's a flood of oxytocin, or a hug that lasts 20 seconds, a flood of oxytocin. So it's funny because this morning I'm like, Justin, will you please stare at me for at least 6 seconds today? And will you please hug me for at least 20 seconds? Because I'm like, I think that might be a missing ingredient here, the oxytocin thing. So I wanted to say that. And before I ask you my next question, Liz, or actually I'm going to have Teresa ask you the next question, I want to be sure to plug our podcast partner, We Heart Nutrition. Teresa and I love We Heart Nutrition. And I'm sure our listeners, if you've started using We Heart Nutrition supplements, you also are loving this company. There's many reasons I love the company, but some of my most highest praise is in regards to them giving 10% of their profit to pregnancy centers. And I love that so much. And our listeners get 20% off of their supplements. Currently, I'm taking a multivitamin for women 40 and above. I'm taking the omegas. I'm taking magnesium glycinate. And I'm also just started taking Wholesome Balance, which is really good, again, for hormone support, hormone balance, PMS, all of that. So if you listeners are looking for a high quality supplement, that is bioavailable and you'll absorb actually the vitamins you're taking, please head to weheartnutrition.com, type in genius for 20% off your order. Okay, with that, Teresa, I'm going to punt it to you for the next question.
Okay, I want to get a little bit more specific into the hemorrhoid thing. I know this is like, it seems weird to say that, but I think people are probably wondering because women, it's funny, like I'll be in the office with a woman and she's kind of like embarrassed to say, she's like, I think I have a hemorrhoid. And I'm always like, girl, you and every other woman on the planet who's ever birthed a child. So do not think you are special out here, girl. But we don't think about men having hemorrhoids as much. I think because childbirth often is kind of a point where women will notice that that change has occurred. But what are the specific modalities that you use for internal hemorrhoids for men and women? I'm just curious about that.
Yeah, it's one modality. It's called the Keesey, Keesey technique. It was actually this little old man taught me this, and it was from the 1920s, something crazy. It's in a book. It is actually using negative galvanic current. We go into the actual canal up a couple inches where internal hemorrhoids form, and we actually put current directly into the vein. So it's a failed vein, right? So it's like a varicosity you see in your leg or something. So it's a failed vein up in that colon, or at the end of the rectum there, above the sensation line, so you don't feel where I'm at. And we actually put current into that. It takes a few minutes per site. That causes a chemical reaction, and the vein will actually collapse on itself in the next 10 days. So it's vulnerable, awkward, uncomfortable. You lay down on the table on your side. I can do 2 sites per time you're in. So maybe 20 minutes of having a scope there, which feels strange. When we're done, I do some calming, some sympathetic calming to the abdomen diaphragm to let your body know you are safe, even though you just ignored its signal to get off the table for the last 20 minutes. And within the next 10 days, that shrinks back. And usually your external ones will pull up and in because the externals are actually just a result of having that internal. So if you have external hemorrhoids, fissures usually have a hemorrhoid right above them also. So yeah, it's great. I mean, the laundry list I rattle off for men and women is the obviously protrusion on the outside, bleeding, itching, irritation, feeling like you have a bowel movement, but did I empty all the way? I still feel like there's something in there. Fluctuations of bowels. So many people we have come in have been diagnosed with IBS. We get rid of their hemorrhoids. They're able to empty more completely. They don't have IBS anymore. Granted, we do other visceral and fascial mobilization for the digestive system, work on pelvic floor and breathing. But yeah, I feel like hemorrhoids are usually not the source of the problem. They're usually not the root cause. However, because of childbirth, poor diet, pelvic floor dysfunction, heavy lifting your whole life, or men puckering up that rectum and never being vulnerable and I got this, I'm fine. So the hemorrhoids, once they form though, they can cause so many issues. They are now the main source of pain. So you may get rid of the other root problems, but you still have these hemorrhoids remaining internally. Go to walk-in or something when they flare up or thrombose externally, and they'll get salves, suppositories. I work very closely with a surgeon here, and he usually says, man, these are not bad enough for surgery. It's not a hard surgery, but it's a very painful recovery. Go see Liz. Whatever she can't take care of, get back to me. So yeah, that's kind of the short on hemorrhoids.
That is amazing. I just think it's such a relief to know that there's other modalities for treatment of hemorrhoids besides like just salves and kind of like fix your constipation. It just seems like what? Like they're so uncomfortable. And I've seen women have the surgery and oh my goodness, that is not a pleasant procedure. And so if there is other ways, I'm grateful to know that. I also want to ask about varicoceles because there is, of course, a tie to varicose veins, obviously in the same kind of like pathway of dysfunction there. Do you do anything with varicoceles? Because that is, I think that affects around 15% of men, a varicocele, which can affect obviously fertility at some level for some men, but also might affect comfort too. So is there any modalities there?
Yeah, it is. It's very painful for men, and depending where they're at in their life, if fertility is still a concern or not. So with that, it's one of those things, again, pelvic congestion, pelvic floor muscles. When there's a varicocele, that vein has failed. The little valves that help get the blood up have failed. So usually it's a surgical fix if it's really painful. Can we give them tools? Can we teach them soft tissue work to do on their own? Yes. Can we help reduce the severity that they feel? Yes. Can we give them, again, I guess a tool they can do? Say they're working and, oh man, this is really painful. I know I can lay down on my side. I can do this same release to myself and help. However, if it's really bad, they're going to stand up, that blood's going to pool right back there. So unfortunately, that is more of a surgical thing. However, talking the men through the surgical procedure, again, because of the fear there, and then come see us right after so we can work on decreasing any adhesions or scarring, because there's a lot of very intricate structures and there's a lot of protective nerves all through that space for men that if we can teach them to work on that right away, it will improve their recovery so much.
Okay, so Dr. Jones, I know for sure there are going to be people listening that do not know what a varicocele vein is, and especially the women who listen, and if men listen too, and maybe they've been struggling with getting pregnant and they just literally cannot figure it out. They cannot for the life of them. And it could be something with the husband and something that could be maybe surgically adjusted or again, tools. So just break down what a varicocele vein is and talk about you kind of already did, but remind the listeners, how they can go about getting diagnosed, the husband, with the varicocele vein.
Yeah. So if you're familiar with what a varicose vein looks like in the leg, it can look really big and like a big caterpillar crawling down the leg. Picture that on a man's testicle. It's very uncomfortable. Our nervous system is very protective of our reproductive system. So there's a lot of sensation. So yeah, you can usually a man will notice it and not say anything about it because it freaks them out that why is there all of a sudden feel like there's this fluffy caterpillar in my testicle and I can literally trace it up. It can be very alarming for a guy. So yeah, it's pretty easy to palpate, and that is something to see a urologist for right away, I would say, and especially if there's pain there. But I think it's just good to get it cleared. My thing is always get that baseline level. Is this problematic or not? But yeah, and then women, I mean, if you're ever touching your men's testicles, which is great for their arousal, you can literally feel it. Be very gentle because again, sensitive areas for them, but you can definitely feel that very easily.
Dr. Jones, let's go into a little bit more, maybe if you're willing to share. I mean, I think you have a personal kind of experience around like your own journey and your pelvic health, or not pelvic health, but endometriosis possibly. And like, if you're willing to share a little bit, why, I assume that this is why you're also so passionate, because everybody has their own personal story. So if you would like to share a little bit of that.
Yeah, I mean, that's like a whole nother side turn. Yeah, I did. I've got 5 children. I've got a practice that we started in 2007. So I've kind of always had a very busy life with a lot of balls in the air. And I always put my own pelvic pain off because growing up, I had really, really heavy periods, but I also had a friend who had horrible migraines every period. So I was like, man, I'm getting off pretty easy. I just have heavy periods and a lot of cramps. Was a college athlete, just really had that push through mentality, which I think also kind of stems from endo because it's just what you know in a way. And so fast forward, I was getting to the point where my fatigue was getting to be too much. It's like, I know the things to do. I know I should work out. I know I should eat better, but I feel like I just can't ever stick to anything. So tired, have to go to bed by 8:00. So I've got 5 children. My last one, actually, I had a mastectomy reconstruction, and 2 weeks later found out there was a little soul in there. So that was a really tough pregnancy of kind of a surprise, right? And then also my lymphatic system had 0 chance to even recover from a mastectomy, double mastectomy. So after that pregnancy thought, okay, my body's been through a lot. Just give it some grace, be gentle. And after a couple of years, I thought, I'm not okay. It's really hard to be a wife and a mom and run a practice and actually feel like I can have joy, right? Because I was just so tired. So anyway, realizing I do have endo. I know I do. I'm not near as bad as most of my patients because I can function. And people around me are like, what? You seem fine. Well, yeah, sometimes we get the grace to smile and hold space for others for 45 minutes at a time in treatments. So yeah, I did. I went out to Dr. Duke in Post Falls, Idaho a year ago. And I mean, a part of me wishes I would have done it 5 years ago, realizing what a shell I had become of myself, because you start to really have a lot of behavior modifications to just cover your basic duties, right? So I used to run half marathons. I used to, I got to the point where I could walk 3 days, but if I walked 3 days in a row, I didn't recover very well and I felt really crappy. And that's where it just got so disheartening of what is wrong with me, right? So yeah, I am passionate about people really listening to their bodies, men and women. We have this beautiful system that takes in our surroundings all the time and tells us if we're safe or not. And if we ignore that, the body's not sure if it can trust us to make the decision, is what I kind of see. So just, yeah, I'll stop there.
So, Dr. Jones, thank you for sharing that. And again, it is just a beautiful thing. And I know men do this too, but I find that women, especially, we just have this, it's probably like that inner maternity in us that when we suffer and we learn through that suffering that we want to serve others in what we've learned, So it's beautiful that you're devoting your life to some of these complex cases because you yourself suffered and you had to learn through it. And again, like you said, this could be a whole other episode where you go more into your story. But what did someone reach out to you? How did you know to go to the pelvic floor therapist? And that will lead me into my second question of who ideally are people for sure who are listening, hands down, should see a pelvic floor therapist. No question. Like, if this describes your case, and you might say everyone, but as much as you can, be very specific. So tell us how you came to it, and then who do you think needs to get into the pelvic floor therapist, like ASAP, if they haven't considered it yet?
What brought me into pelvic floor physical therapy, again, the simple truth of, I don't understand why in PT school we're learning about core stabilizing, all this stuff. Why is no one talking about these main muscles that are at the root of it all? Why does no one talk about this? And then when I started doing some continuing ed to advance my women's health 20 years ago, it was a lot of contract, relax, strengthen. I'm like, this doesn't make sense. If someone had a tight bicep or tight upper traps, I wouldn't tell them to do more bicep curls. I wouldn't tell them to shrug their shoulders more. Why are we doing that in the pelvic floor? So that's kind of where I guess my passion kept going. It's not at all where I never thought I'd be treating pelvic floors and hemorrhoids. That was not my thought coming into PT school. Who needs to see a pelvic floor therapist? Yeah, of course, I have a hammer, everything's a nail, right? That analogy, but it's the base of our foundation. It's vital. I mean, definitely if you have any incontinence, coughing, sneezing, any digestive issues, honestly, we deal so much with constipation issues, fear avoidance. If you've got this weird SI pain that just never goes away, we work with a lot of chiropractors collaboratively, but if it's like, oh, my hips are always rotated, that right there tells me your pelvic floor is not doing its job. Or do you have some weird adhesions or pulling of that, the uterus pulling, the uterosacral ligaments pulling on the sacrum weird? Your sacrum's not going to stay there if your uterus is inflamed or you have adenomyosis or endo all along those uterosacral ligaments, and there's a constant pain there. So your body guards it. Your sacrum's always going to pull out of place because your body's protecting it. We kind of joke from belly button to thigh. If you've got anything going on, see a pelvic therapist. But there's also direct tension pattern and nerve tension patterns and links between the throat, the neck, the head. So women with headaches, it's usually your pelvic floor. I mean, that's a lot of times a concern. So yeah, I guess I think it's great because I feel like a pelvic floor therapist has a very deep understanding of the structure of the body that someone who's never even done any training in pelvic floor just isn't going to have.
Right.
And I think it's a huge piece.
You know what? I'm just going to ask, personally, so I ran track, okay, and I always have had hip pain, always. Like, I have had a fracture in my femoral neck. They said your fracture would be like you got in a car accident and your feet were shoved up against you. That's where that fracture is, in the femoral neck. It was just from probably powerlifting and doing like the quick, like jumpy things with lots of weight and running. And I've always had hip issues, especially on my left side, always. And so, of course, I go to the chiropractor and, I go to massage because my IT band is always just terrible and my hip flexor, it's always on my left side. So let's say I were to make an appointment to go to the pelvic floor therapist, because this summer, my goal, Dr. Jones and Teresa, hear me say, all of our listeners, for 10 years. And I know this for a fact because I put it in my dream journal. Yes, I have a dream journal and I date it and I have like, this is what I want. For 10 years, 10 years ago, I said, I want to run a 5K. I can run a 5K, but I want to run a 5K with no pain. And if there is pain, I don't let myself run it. Like it's just like a rule I've made against myself because I'm always injured, you know. And so it's been 10 years. I'm not joking. This summer, it's the summer it's going to happen. So let's say I'm your patient and I come and I tell you that whole thing. What would be the first thing you do for me? Or like, what would be the first thing we do?
I would smile and say, that's a great goal. Are you listening to your body? Right? There's a lot of things we tell our body we're going to do. And it's like, okay, you're not listening, right? You know, ilioinguinal, iliohypogastric nerves, the lateral femoral cutaneous nerve. These are all these major nerves that come from the spine, go through that pelvic area, can give you a hip pain. So what if your ilioinguinal nerve or iliohypogastric nerve was irritated way back then and you just kept powering through it and your body keeps trying to protect this nerve, right? So it starts compensating and then this muscle compensates for that muscle and all of a sudden you have this wonky gait pattern, right? Lateral femoral cutaneous nerve, you have tight IT bands, that nerve pierces through the fascia of our IT band all the way down our leg. Sometimes, as silly as it sounds, it's just this little fascial ring that nerve comes through that's tight. And if we can release that little fascial ring, your IT bands aren't tight anymore. So I would take a deeper dive into your body and we can do a lot external. We can do a lot internal. Obturator internus is a major hip rotator, which also connects to the same ligament as pelvic floor. Yeah, I would take a deep dive into that because obviously for 10 years you've been working on this, but something's not working because you still have pain. Yeah. And for some, the jarring, it's just not good for the body anymore, which is hard to accept.
Right.
But yet sometimes it's that surrender of, and why did you want to do that? Because maybe it makes you feel healthier, right? So is your goal actually, I want to be healthy. I don't want to have pain anymore. Well, you can do that without causing more pain to your body, right?
Yeah.
It's just those hard things.
Yeah. It's so funny because I remember I was training for a marathon years ago and I had a bulging disc and I started having like this vibration feeling in my body. Like they're just randomly, I'm like, I am never going to train for a long distance race again because it is terrible for my body. 5K, it's just more of like this, like for your endorphins, for your mood. I'm such a high energy person. But yeah, it's like I think what it is, I need intensity. And whether it's a 5K or something else doesn't matter. It just needs to be intense where my heart rate gets up and I sweat. It's almost like therapeutic, probably for me. And I wish I could do it more and I just don't because I really love it. But that's really helpful. Thank you so much. I really just need to make an appointment.
So come to North Dakota.
Yeah. Oh yeah, I'll drive there.
I know we're getting close to the end here. I do want to just quick go over the physiologic aspect for men, because again, this is something that they aren't told, the physiology of their erection. No one talks to them about this and they get really poor information from the world. Even women, I always say, society is telling you that everyone's having mind-blowing orgasmic sex every day. They're not. If you are, great for you, but please don't put that pressure on yourself. We talked about the men with, if they're concerned about their wife. One thing I do also tell them is I go through the cycle of their wife with them. I'll say, do you realize she's only fertile a few days out of the month? So there's only a few days she's really desiring that. So if she seems uninterested, it's not usually against you, so to not take that as a rejection of you, but realize hormonally her body might be saying, we don't want to reproduce right now. So I explained that to them. I also explained to them that most women don't, and I do say this to women too. So I explain this to women too, because they they often don't know this either, that most orgasms for women are clitoral. So again, people get this idea from society that everyone's having these deep orgasmic, and explaining to men, like they have, and you guys do a great job of explaining that too, how much more sensitive the clitoris is than the deeper part, right? So explaining to them that also women don't have pain if they don't orgasm, as men do. So if your wife is good, men have this pressure to always make sure their wife is pleasured completely. They have this in their head. It's told to them, if you can't pleasure your wife, you're not a man. And those are the things I say, have that conversation with your wife, you know. A lot of women will say, you know, when I'm really busy and I'm stretched thin and the kids have been up all night and I'm tired, I want to connect with you, but I actually can't calm my body down enough to orgasm. And then there's a lot of pressure on the woman to orgasm because she doesn't want her husband to be disappointed or feel rejected. So that open conversation that, you know what, I don't always have to orgasm as a woman, but I'm so happy when we connect. You do, you feel completed. I don't feel gypped, you know, and I'll tell women, explain to your husband, sometimes when you have kids, let's have a fun little quickie, but maybe you're not pleased. I'm okay. Let's have a fun little quickie. You're good. We've connected. We can giggle about it, you know. And for some women with pelvic pain and with venous insufficiencies, actually, if they have a deep orgasm, they might have more pain after intercourse. So some women don't realize they're actually avoiding I'll say, you know, your quickies were nice to be there, but you didn't orgasm versus a really good session of intimacy where you do orgasm. And about 10, 15 minutes later, you have this dull, achy, a lot of pain in your pelvis. That's a venous insufficiency issue a lot of times. So again, those veins have failed. Now they have too much blood sitting there and it's painful. So they'll often get that after really good episodes of intimacy, and they'll get it the first day of their period. So that's a sign to me of venous insufficiency. So explaining that, right, that she might not even realize she's kind of avoiding because, man, actually, when we have really good sex, I kind of hurt after. Now he's panicking. I'm hurting my wife. The physiology of the erection for men, I think, is so important for them to know because so there's genital stimulation. They might feel that blood flow, a little bit of engorgement. If everything's fine, your sympathetic, meaning fight or flight, is not ramping up. You're feeling safe. You're okay. You'll start to get a little bit more of an erection. And then at that point, and once you get that more rigid erection, there's certain muscles in the pelvis that kick in to help out. Knowing that it is normal for an erection to wax and wane. So men freak out if that erection starts to decrease. That doesn't mean there's something wrong. It is normal for that to kind of wax and wane. And then when it comes to penetration, it is so important for men to know the average time to ejaculation with penetrative activity is 7 minutes. That's average. So if a man is aroused, he's so excited to be with his wife, things have been going well. As soon as there's penetration, if he makes it 2 minutes and ejaculates, that's still normal, you know? And so this pressure to hold on and not ejaculate right away, that will ramp up sympathetic, turn down the volume to circulation, and they lose their erection. And now there's this compounded fear, anxiety. So I go through that with men because they'll think I have premature ejaculation. Well, 8-10 minutes, that's not premature. You know, it might not be as long as you'd like to be there enjoying. But again, normalizing the physiology, I think, is so important for men and women in that regard. And talking about the fertility cycle, you know, it is so painful for a couple when they're trying to conceive and they can't. And then there's more pressures, the timing, the this, the that. It can become very sterile. It can become very, I'm taking this medication, let's go now. But hormonally, she's all over the place because of the medication, and like giving grace to that. And just as much, again, I have 5 children. It can be just as hard of a battle when you have multiple children and you're very fertile. Maybe for whatever reason, you feel like you really need to space pregnancies. The 3 days of the month when the woman is the most engaged and your hormones are all talking to each other, you are trying to refrain from having intercourse. That can be just as painful for couples. So I think it's important to bring light to that. If you're doing NFP, yes, it's this beautiful natural rhythm, but there can be a lot of things it brings to the light that can be really hard and a lot of sacrifice for both of you that doesn't always go well. It's tough. So I think it's important to bring light to that too.
Man, you just brought up a whole lot of great, I just feel like we need more time. And so we're going to have to bring you back on in the future. But the things that I want to say that you've really driven home the points on is, one, that we really need to understand our natural physiology as humans, and we need to understand our hormones. And the more we understand our body, the more we can actually connect to our own identity and who we are as human beings and what's going on in our own bodies, but also connect to other human beings, particularly, of course, the most important people in our life, our spouses. So communication. I remember years ago, my husband and I used to do a lot of talks for engaged couples, and we would always talk about what are the most important things that make a successful marriage. And my husband would have this quote that he had gotten from someone who was a specialist in marriage. It was communication, communication, communication. Like, you cannot understate how important it is to be open with somebody, and it's difficult, and to communicate through what you're experiencing. And there's healthy ways to do that. And I think pelvic floor therapists are kind of a gateway to that, really to seeing who you are as a human being and opening up that process of what's going on for you as a person, but what's going on for you as a couple as well. So I'd encourage you to reach out to your local pelvic floor therapist, but just know, like, not every pelvic floor therapist is probably the same. And listening to Liz here, you realize like her gifts and her talents in this area, and really try to seek someone out that you feel really can give you that same experience. But as we wrap up, Liz, of course, we ask every interviewee the same question. So we're going to ask you now, what do you wish every woman knew about her hormone genius?
Yeah, a phrase I say all the time in my treatment room is the awe of how beautifully and intricately we have been created, the physiology of our body, and to go back to that simplicity. And I think men and women, I hope they can see that in themselves, the goodness of who they are, to not let shame, grief, sadness hold you back. And, that we all have wounds, that we're humans, right? We all have wounds, and that those that we love the most also have wounds. And when we react to something, what wound is this striking, and why am I reacting to this? It might be something silly. It might be a thought pattern. It might be, and then also, what wound do they have, and why are they reacting that way? Right. So yeah, just again, when you look at the intensity of nerves, even a nerve checks in with itself, right? Our whole body has all these fail safes. And so I think instead of pushing through and ignoring signals, just again, remember how beautifully, intricately, and intelligently our bodies were made, and to just kind of step back and listen to that a little more.
I love this episode. In our chat box, sometimes Teresa and I chat with each other, just like, you're up next, or I have a second question, so we don't overtalk. But a 2.0 episode is in order. Because I feel like we started lots of conversations that we want to complete. You know what I mean? It was so good. And you did such a good job kind of moving with us as we come, and as you did such a great job. So as we close up, where can people learn more about you, your work? If someone has a question, how can they learn a little bit more? Even is there like a database or something to find a pelvic floor therapist near you, or how that goes? So,
I think there are a few. And again, this is the thing where like you get so busy in your own little world, right? Of kids and work and this and that I'm probably not on all those databases. So jonespt.com, our clinic is called Jones Physical Therapy. When I started, I thought it was just going to be me. We have 8 physical therapists, 6 deeply trained in pelvic floor. So now I feel silly. It's Jones when there's a lot of us. But anyway, jonespt.com. We also have a Facebook page, just Jones Physical Therapy. We put some information on there. We've got a resource page on our website that has we call them breakfast clubs, where we talk about things. I'm really not big on social media. It's something there's a time warp for me, and a kind of an energy suck. And even though I know it's so great for people to reach you, my email is actually elizabeth@jonespt.com. I'm fine if people email questions. For men, I'm going to put this resource out there. Dr. Susie Gronsky is phenomenal. She's one of the top pelvic floor therapists for men, and she is brilliant. Pain neuroscience, all sorts of things. She has a really cool setup on her website. It's drsusieg.com, SUSIE. And she has a really great resource on there where men can click on there and actually have a consult with her. And she's brilliant, because a lot of men don't want to come into an office and talk. Most of us pelvic therapists are females. She is a wealth of knowledge and just a wonderful human being. So that's a really great resource for men. And if women are like, my husband will never come see you, I say, look at this website, do a consult with her. It does cost money, but again, can really, so much of the concerns come down to a fear thing of, oh my gosh, I don't know what this is. And just the more knowledge we have, the better, right?
Mm-hmm. Yeah, very good. Thank you so much. And again, we'd love to hear our listeners' reviews on our podcast in general on this episode. Be sure to like and subscribe to our channel and leave a review again if you're loving the work we do. Thank you so much, Dr. Jones, for being on the call with us today. And thank you, Teresa, and we will see you in our next episode. Thanks for listening to the Hormone Genius Podcast. Please remember to share our podcast with your friends and family, and also follow us on social media. If you were not aware, we have a YouTube channel, so if you could like and subscribe to our YouTube channel to stay in the loop with all of our latest episodes, we would appreciate that. Thank you so much for your support. We are excited to journey alongside you as you discover the beauty and the genius of your hormones.